Oi, bonitas. I hope you're doing well this day. Today we have Dr. Williams, this amazing, beautiful woman of color, and we're gonna be talking about skincare and the peels and skin of color, and also inspiring journey that Dr. Williams is going to share with us. Okay, Dr. Williams, share with us a little bit about your journey.
So I'm Danielle Williams. I'm a family physician and I'm board certified. I've been board certified since 2018. I also just have a passion for skincare, taking care of skin of color, and different disparities that have just, I'll say, affected persons of color more than others. So that's a little bit about me. Um, I decided to start my own business recently. So I have met
Yeah.
Yay. Yes, Medically Fab Beauty and Wellness. So it's a med spa. We're located in King of Prussia. We just opened in November of 2022, so we're pretty young.
Young and vibing, because I can hear and see that you're doing very well, and I'm super happy for you. So, let me ask you a question. What do I need to know about you in your earliest years to understand what led you to get into medical school?
Ooh, to get into medical school, I'll say, so I grew up in Baltimore. I'm born and raised in Baltimore City, very similar to Philadelphia, I would say. And I've always been a bit of a nerd, a little bit of a science geek, why things do what they do has
Mhm.
always interested me. And my mom was a practicing nurse when I was younger. And she seemed to love her job. She told me stories about her patients every day. And she just seemed so passionate about the healthcare field. So I could see that she was getting satisfaction from her job. She
Mm.
seemed happy, and watching her help people through serving in the healthcare field kind of inspired me really to kind of look into a career in health. So I did go to Hampton University for undergrad, go HU,
Eh,
Virginia, yes. And I studied biology while I was there. I did pretty well. I did very well, actually. Thank you, Lord. And
thank the Lord.
amen. So I did well there, and then I went into research. I thought I wanted to be a research scientist. I could serve more people over time by going into research, I thought. But the bench work wasn't really my passion. I didn't get to talk to people. I didn't get to form relationships. I didn't get to just watch someone's journey from me, like prescribing something, learning about them, and then following them along. So I didn't get the satisfaction that I was expecting. I did go into medical school from there, though. Decided I wanted to do more of the science where the medicine and actual conversations were happening. And
Mm,
that kind of prompted me into med school. I chose family medicine because every day is different. I'm
mhm.
meeting people, I'm meeting all different family members. I'm following them from the womb to the tomb. That's what we call family medicine, literally.
From the womb to the tomb. Love
Oh,
it.
so I love it. I also just really started to learn a lot more in my practice in Philadelphia, really about how disparities are affecting people of color, disparities in medicine, both the delivery of medicine,
Mm,
the access to care pieces. There are such unfortunate, I'll say, and disproportionate um, availability of services uh,
mhm.
to people of color. And so, yeah, that kind of prompted me to really want to go into family medicine. I've always had a love of aesthetics. I've always, I love to look good when I'm going to work. I love how taking care of my skin makes me feel. I love how I present when I know that I'm taking care of myself from the inside out. I'm taking my vitamins, I'm exercising, I'm using my skincare regimen, my morning, my night. I'm investing in my self-care. I'm treating myself better. Therefore, I'm addressing my health better. And I look good while I'm doing it. you know?
And because you feel good, you actually more productive because you feel good, right? You're able to be a mom, to be a wife, to be a business, owner, to be present for your patients, to be present for your cosmetic patients. So it's everything is connected. Once you feel good about yourself, then everything else it's part of the process. Even with the stress, we carry with grace somehow, especially if self-care is a priority in one's life. So I would agree with you. I feel the same way.
Word, yes, that is
So
word.
yeah, so tell me a little bit about when when you decided to get into the cosmetic part of, your practice, and what makes you choose a particular brand for treatments, procedures, or even the home care products as well.
Yeah, so actually getting into the cosmetic space of medicine started with my family medicine.
Hmm.
So the concerns of especially acne care, that's one of the most common questions, concerns that I'll get in my family medicine practice, especially from teenagers up to, like, I'll say women in their early 40s, around
Yeah.
that age range. The post-inflammatory scarring, it's a concern. It's your, especially when it's on your face. So this is going to be one of the most common presenting problems that I was being faced with in regular practice. And so I'm treating these issues. I became passionate about it. You see people's self-esteem raise as they're starting their regimens. And so gradually it naturally progressed, I'll say, into me
Mhm.
wanting to start a med spa and focus a lot of my practice on cosmetic care. And when I pick a particular product or brand, what makes me carry that here is it has to be something that is going to address the concerns of all skin types. We cannot leave out skin types 3 through 6, which are the darker skin types. And I think traditionally aesthetic medicines and treatments and lasers have not been formulated with skin of color in mind. So when I chose to carry the peel brand that I carry, the VI peel, for instance, it was formulated by a professional of color. And that mattered to me.
I didn't know that.
Yes. So that mattered
Nice.
to, yeah. And so and the brand, they truth in it, they are formulated for skin types 1 through 6. So everyone. And I like the fact that their social media shows that they are trying to be inclusive. I don't want Black women, especially, to just be a poster child of,
Mhm.
diversity, equity, inclusion. Show me that your product works. And when I did my research on this product, I was very satisfied with what I saw.
Mhm.
So, and the same, I'm not gonna be able to carry any lasers or treatments that will only address skin care problems for uh, skin types 1 through 3 or lighter skinned people. I want everyone who comes into Medically Fab to feel welcomed, included, and we can address your skin here.
So what is the there are different med spas that they carry different back bar, different treatment products in their, toolbox, from glycolic and a combination of salicylic and lactic acid or whatever. Um, and they are treating all skin types in the same pool. So as a doctor and a professional and a woman of color, what are the things that a woman of color should be aware or aware of when they are going out there to get a chemical peel?
Such a good question. When you are going out to get a chemical peel, please make sure that you are getting a peel that is going to be more superficial to higher medium depth. One of the issues that we face is that if you go too deep with your peel, you run the risk of worsening your hyperpigmentation. You can get worsening inflammation and literally burn. So you don't want to get a chemical peel that may have a high percentage of acids and goes too deep. And the next thing you know, you're worse off than when you started. It's the same for lasers. Like you don't want to be worse off than when you started. So kind of vet your professional, ask them these questions, like I would like a chemical peel, or do I qualify for a chemical peel? Be educated as well before you go in to know that you want to stay more superficial with your peel. It may require you to kind of come back more frequently, or to have your peels every 4 to 6 weeks for a set of 3, but it's safer, way safer than if you try to, go deep on your first or second peel and not find a professional who knows that that's not right for you.
What is your favorite acid? Just give me one.
What? Retinoic.
Why?
Retinoic acid. It is probably the one product I cannot live without. Retin-A has so many positive benefits, from anti-aging. So if your regimen and your plan is to prevent or delay onset of wrinkles, Retin-A is going to increase that skin turnover. You need it to help you prevent the wrinkles there. If your problem is acne, retinoic acid will also help to suppress those sebaceous glands. You won't get as many breakouts. All right, so we've solved 2 problems, or addressed 2 problems with retinoic acid already. Retinoic acid also helps with hyperpigmentation. It helps to decrease those overactive melanocytes, okay? So hyperpigmentation, acne, wrinkle care, retinoic acid is like the one ingredient I would say everyone needs.
So what about the side effects of retinoic acid?
Yeah. So nothing is without side effects. So nothing is without side effects. When you first start Retin-A, like I said, it is going to help with skin cell turnover, but you're going to peel. You may notice some redness as well. It will make you photosensitive. In other words, when you go outside, you will need a sunscreen. So please be aware that UV light and retinoic acid are not good friends. We're outside as part of our daily lives. You would need an SPF of about 40 or higher once you commit to retinoic acid. Yeah.
Are you into the whole skin cycling?
I'm not. I can't say I'm into it.
Me neither. I mean, and I need to understand the thought process. I don't know her name, but she's a dermatologist out of New York, where she recommends to use retinol acid recovery time. Retinol, a type of acid, and then recovery. And I was thinking about it in terms of, I truly believe, and I like the idea of giving the skin a rest, like every other night, and then build up to every night, depending on the percentage that you're using in combination. But I'm still trying to wrap my head around the whole skin cycling, approach. So I was just curious to know, what you thought about it.
I've heard both, I'll say, what's the word I'm looking for? Goals of treatment, I'll say, around the cycling is that over time, your skin usually develops, I'll say, some tolerance to the retin-A or any other acid, really. And so there's I'll say, a group of folks who believe that stopping it for a while will then allow your skin to kind of be shocked when you start it again later, and it should work again. So if you start to notice, hey, I've been on my retin-A and now I'm starting to get breakouts again, there's a school of thought to that, to stop, try something else or a different acid, and then go back to what worked, and it should kind of shock the skin back into that. I don't have a lot of people who enjoy doing that, because usually when they find something that works and something that's as life-changing as retin-A, the idea of stopping it is scary. They're afraid the breakouts are going to come back. They're afraid that the skin might look worse. So, it's patient preference is important too. and what they're comfortable with, but there's a school of thought and it makes sense. I'll say it makes
Mm-hmm. Mm-hmm. Mm-hmm.
like
So can we talk about fillers?
yeah.
So you offer different types of fillers,
Yeah,
correct? Okay,
correct.
can we talk about that?
Yeah, so let's talk. So filler, what is filler? What is tox? And I want to make sure we understand the difference.
Please,
Yeah,
what is
so
the difference between, yeah, that's a better question. Because
yeah,
my clients ask me all the time, like, Botox injection or they talk about, they point, right? Botox injection here, here, here. And I'm like, no, not here.
right,
I
right.
know that for a fact. Like I have worked with a dermatologist before, so I've, witnessed injection. So when they pointed down here and I'm like, that's not right. It's only forehead and some areas on the upper cheek. So you can tell, you can describe them better than I do. So yeah, teach us, doc.
Yeah. So let's start with the difference. Let's start with tox. Okay. So commonly we refer to Botox as like the brand that everyone's familiar with, but it's just one brand. Botox is going to be used to help soften wrinkles. So
Mm,
yes, that would be the forehead. So where you have wrinkles, okay. Now I'm not a great candidate, I'm not a great example because yes, I use it and so I don't have many. But if I raise my forehead here, for instance, here, if you raise your eyebrows and you start to see lines across and then folds of muscle, that's where Botox is going to help. It helps to kind of soften and freeze the muscles of facial expression. So when you start to overuse them, the muscles can get hypertrophied or enlarged. And then between them, you get lines. Over time, you can get lines at rest or static lines, which means even when you're not forming facial expression, like raising the eyebrows or anything like that, you can see deep set lines. Okay. Tox can help to soften those deep set lines, but usually once we reach the point of static lines, it's harder to treat. Okay. So tox will soften but not eliminate those lines. Same when you smile and you'll get little lines here. Crow's feet. Tox will help that, freeze the muscles there to help with the crow's feet. Yeah, we don't usually use a lot of Botox around this area. You can
yeah.
use it for a lip flip. So that's where you may just put a few units right here above
Mm,
that top lip, and it can just start to evert the top lip slightly without filler. So that's where you would use Tox. So Tox functions to kind of soften wrinkles. That's what it does.
mhm.
Filler is a whole different ball game. It's still a facial injectable, but filler is going to be used to fill areas of low volume. Okay. So for instance, wherever we're losing volume, and especially in younger folks, it may be more so to kind of amplify places where you want more volume. So you'll see commonly lip filler. As we age, you will lose volume in your lips. So you may benefit as you age from just well done lip filler, okay?
Can you repeat that, doc?
Well done. It does not have to look unnatural, especially you want to look like the best version of you. You want to look like yourself, maybe just a little younger. You don't want to look like someone else. You don't want to look like a photo of someone else. Focus on being you. This can be very tastefully done when you have realistic goals to look like a younger version of you. That's it, or more
Oh,
awake,
fresher.
rested and awake and fresh.
Yeah. Yeah.
Yes, that's the
Yeah.
goal. So common areas to get filler are, of course, going to be the lips. The lips
Mhm.
lose volume as we get older, usually in our 40s, like they just start to thin out. The actual space, I'll say, between the bottom of your nose, so here, the nasalis, and then further down to the cupid's bow, this gets longer as we lose volume in the lips. So lip filler is a good way to treat that.
Mhm.
Compressor nasi to the actual cupid's bow gets longer. So yes, putting filler here will help to shorten that and make you look younger. Okay, like your younger version of yourself. Same here. Over time, as we age, we lose bone volume. Okay, so we actually start to resorb, or bone starts to resorb naturally, and that includes in our faces. Okay, so we have a common curve here called the OG curve, which is a very feminine curve when it's enlarged in the cheeks, and very commonly in melanated ethnicities, Black women especially, we have a larger OG curve. So here, when we start to lose volume and our cheekbones start to resorb, it makes us look older. Our skin here starts to sag, right? We start to actually get a
Going
fold.
this way. Yeah.
Yes, exactly. It folds in. So one way to help not only make you look younger, but one, to kind of lift the skin here is to actually put a little filler in the cheek.
Oh, wow.
Naturally, yeah. So put a little cheek filler will help to kind of raise or kind of fight that, sagging skin inward.
Mm-hmm.
Putting filler here will start to help to lift. Even if it's just a millimeter or two, it makes a big difference
Mm-hmm.
in that feminine curve here and the lift you get. So putting filler in the right places for the right reasons as we age makes a lot of sense. So when you say different types of filler, yes, I carry different types of filler, which mimic the natural tissue of where we want to fill. So we have some fillers that mimic bone, right? So if I'm putting cheek filler, I want it deep and I want it to kind of mimic bone, because that's what we're starting to enhance, where you've lost bone volume. So we want a filler here that mimics bone, a filler in the jaw that mimics bone, right? Lip filler is going to be soft and pillowy. That's the goal. That's these are my aesthetic.
Softer.
I don't want filler in your lip that feels like bone, So fillers are meant to mimic the tissues where they belong. Yeah.
So then how long does it last? These injections, that's toxin, that is also fillers. How long does it, and I know that it depends on the client, the patient, but what is the average?
Average for your toxin, so your Botox, also brand name Xeomin, Dysport, Jeuveau. So toxins, those will last you about 90 days on average, right? 90 to 120. And then for fillers, depending on which filler and what's the purpose, they can last anywhere from 9 months to 24 months.
Oh, wow, that long.
That
Okay.
long, that long.
Is it true that any skincare modality such as microcurrent or radio frequency can enhance the longevity of injectables?
Yes, we have heard that, especially radio frequency. Yes, it can enhance. And also anything that's helping to build collagen is going to help you kind of
Mm.
plump that skin. So they actually work pretty well together.
Mm. Awesome. So let's go back to the fillers. So I saw on your site that you have a la carte like injectables, especially fillers, where you just described the cheek enhancement, right? So how often and do you perform that particular procedures mostly in white women or women of color?
You know what? Surprisingly, the people who are coming in, I'm getting a lot of white women who are more open to filler. It's not new.
Mm.
It's, I don't know. That's what I'm actually getting. White women who are more into filler. Um, I think with Black women, we're introducing a topic that has been kind of either one, cliche, or two, we've been taught we don't need it.
It is, yeah.
And it's not true. Everyone ages. But I think for white women, the idea of filler and Botox is something that's probably a little bit more accepted. And they start often a little younger,
Mhm.
a little younger. For with Black women, it's kind of like I'm finding myself trying to do a lot more education and trying
Mhm.
to sometimes change like attitudes and behaviors around aesthetic medicine. So I think it's becoming more popular, especially with like, I'll say celebrity culture and
Yeah.
celebrities starting to actually talk about what they're doing to make themselves look really young. And that we're starting to see that it can be done tastefully, and we're starting to see it more so in women of color.
Do you have a different approach when it comes to like a patient of color? and versus like a Caucasian woman when it comes to fillers, meaning um dosage amount or angle of injections or whatever, because the little that I know about skin physiology, our collagen structure is structured differently, right?
Right.
So we don't show age as fast as Caucasian women, but we show aging differently in different forms. So as a doctor, as a cosmetic doctor, I just wonder if when you look at a face's structure, you having a different approach. Um, Again, as far as the dosage of the vials, and also the symmetry in this case, because I think it's an art form to be able to, one, you somehow you're modifying that face structure with a filler, with something to enhance. So I'm just curious to know if you have a different approach.
The approach difference happens, just common differences in bone structure across ethnicities. I don't think it's worth altering that to look like one prototype. I think we start to look unnatural when you're a woman of your particular cultural background, your particular race, and then you want facial features that are unnatural, So for instance, when it comes to I'll say if one syringe of filler, let's say one syringe of filler is 1 ml, right? And for someone, let's say we have two women who are of different races, but same age, right? The bone resorption that may have happened in a white woman versus a Black woman of the same age is not going to be the same. The common or expected height of the cheek is going to be different based on just your ethnicity. And that's just how structure is. So for instance, I may not use as much cheek filler on a Black woman at 45 that I would use on a white woman at 45. For instance, like, is the problem that we're solving more so bone resorption, or is it more so that you want to look like something else or someone else? And I don't like trying to make you look like someone else because it can look unnatural.
Unnatural, yeah.
It can look unnatural. Same. So filler in the lips, especially for Black women who naturally have fuller lips, you may not need, 2 syringes over time. You just might want 1 syringe of filler, or even a half of a syringe, to just kind of go for the look you want, which is like trying to make both the top and bottom lip the same height, something like that. Whereas if you were a white woman who wanted plumper lips, like, if that's the goal for you, let's focus on your goal. Let's try not to make you look unnatural, right? And then not run the risk of migration. Like when you overfill a space, which is naturally created for you and is a part of, honestly, your ethnic background, you want to overfill a space, you run the risk of that filler migrating out of its intended location. And yeah, not only does it look unnatural, but that's when you start to kind of look, I'll say, noticeably overdone. And it's it doesn't, no one really enjoys that look. Yeah.
Oh, yeah. I've seen it. And I've treated skin like that in my last job. So then what is your recommendation for someone? Let's say I just got some fillers done, for example, right? And so what would you recommend right away, like for me to maintain or prolong those benefits? But the most important thing is, and I don't hear that often, especially from my clients, that they are getting injectables from, different places, that now I'm recommending to Dr. Williams. Okay. Hello.
Right.
And that's why I'm having her in this podcast, because I know my client's going to be calling you. So anyway, so what is the next step? I just had injectables. What would you recommend for me to do afterwards for the, for the first week, second week, and so on?
Gotcha. So number one, as simple as it is drink lots of water. So
Mm.
let's remember how these work. So fillers, hyaluronic acid fillers or HA fillers, are going to plump with water. The whole point is for the fillers to kind of fill in volume. There will be attracting water. You got to give the filler water for it to kind of plump. So drink lots and lots of water. Two, the filler is only going to address volume. Okay. And same, Botox is going to address the wrinkle. The key is there's still skin over top. You cannot, please, we cannot just focus on the wrinkle or the, lack of volume and not treat the skin over top. I want you to invest in a skincare regimen. Please see your esthetician as well to focus on making, yes, go see Vivian and make
Mhm.
your skin, like the skin over top, as well, glow, help prevent further damage, and wear a sunscreen daily. Okay. So if you are focusing on, let's say our goal is to focus on wrinkle treatment and anti-wrinkle treatment. The goal for anti-wrinkle treatment is going to be, yes, we'll start Botox, but then what are you doing in your skincare regimen every day to help slow the onset of further wrinkles, right? So this is where that, your regimen comes in with your retinoic acid. Are you helping to increase your skin cell turnover by, cleansing with a cleanser that's not going to be stripping your skin? Are you exfoliating with an exfoliant that's going to, kind of give you that chemical exfoliation over top, help that skin cell turnover so that your skin is like nice and bright. And then as far as your overnight treatments, yeah, make sure we're using products that are going to help to increase your collagen, and decrease the onset of wrinkles. So get a skincare regimen.
Mhm. And in contraindication for
Contraindication
injectables.
in general. So pregnancy,
Mhm.
oh no, it sounds it's something that I think a lot of people don't think about. But yes, even if you've been on your regimen for years and then you become pregnant, you have to stop. All right.
Mhm.
So that's important to note. So active pregnancy, two, active cancers, and if you're going through cancer treatment. So that is also a contraindication to Botox and filler. So yeah, so those would be contraindications as well. There's not really hard stops on how much filler to give, but
Mhm.
hopefully you're working with a doc that has some integrity around how much they're willing to give, how much, at what point do we stop? All right. So for
Mhm.
me, someone who has unrealistic goals, desired outcomes that I think could be um, harmful. For instance, too much filler, you can actually impact the vessels underneath and
Mhm.
have a poor outcome. Uh, Someone who's maybe has some dysmorphia and you really don't see how much you've changed with the treatments you've already done. There's a group of folks who really forget where point A was,
Yeah.
and time they get something done, this is like their new start point when it's like, no, we have to look back at step one, and this is how much we've changed. So, people who I think become dysmorphic, for me, that'll be a hard no or
No.
contraindication
Yeah.
further any
Okay.
others. Yeah.
Understanding. I feel the same way. I have worked with someone that years ago that in the beauty industry that really lost touch of reality when it comes to injectables. It's just unnatural. But
Uh,
she's in that field where she has access, and the people that have access also have access. So then they are not in touch with the reality. They are in that bubble where everybody is having, some kind of work, and it normalizes for them.
yeah.
And then it's hard to even have a conversation looking at them because it's like, oh my gosh.
Yeah. So,
So in
yeah.
And I can see I can see why people lose themselves in this journey, because
Yeah.
some people do have some low self-esteem, and so whatever the girlfriend is getting or the doctor is saying that they need, they're gonna say yes, not thinking about, oh, but I already just had some injectables of 6 months ago. I don't need that. So once you touch this, then you want to touch this, then you want to touch this, and then now you don't look like yourself. And you might just start looking yourself in the mirror and just hating who you have become. And that there's another issue. So there is that psychological piece when it comes to injectables. Do you hear that from your patients?
I hear
That concerns or reservations?
right concerns and reservations, and that's why I like the go slow process. Like I want to hear what is it from you first. Like I always, when I meet with my clients, I want to hear from you. What is your pain point, as I call it, or what is the area of concern that you have, so I can make sure that we're addressing the same concern in the first place.
Mhm.
If I'm addressing your lip, but you want to talk about your cheek, if we're not on the same page and you're not going to be satisfied with your results, and then to you it'll look unnatural, so or like your problem's not solved. Concerns that a lot of especially Black women have is going to be looking unnatural, or if I add this here, I'm going to look like so and so. When truth be told, like it's about limitations, everything can be done in the low and slow goals. We've kind of become, I'll say, we've exoticized like a culture of women who are overdone. And that's become, I guess, an image that's implanted in women's minds and kind of maybe makes them nervous about coming in. Like they know they want something, they want to address the aging, but they're so afraid of looking like this photo that has been, on the internet, for instance. So is it a valid concern about looking unnatural? Absolutely, absolutely. Let's address your concern. Let's do it in a way that would solve the problem of keeping you looking natural, but also addressing whether it's acne or addressing anti-aging or addressing low volume. Let's just do it in a way that is tasteful and it's tasteful.
So let's shift into body care.
Okay.
Spring is here. We were like, yesterday was a beautiful day. It was sunny and beautiful. And I was like, oh, it's time to pull my spring dresses out of the storage and start wearing them very soon. So, but then as my age and my perimenopause phase, I got a little chubby, and I was like, yeah, we need to work on this. I need to call my girl. Maybe she has something for me. So I want you to share with us, like, you do have a weight loss program available in your practice. And our previous conversation, you kind of explained to me about the process of the injections and a popular procedure that is out there. I would love for you to highlight that with our listeners. But it also, I want you to highlight the pre, during, and post care for something like a weight loss program, because everybody wants to lose weight, but they don't want to sacrifice, the things that they love about it that got them in trouble. And so it's not just going through the injections or whatever you're doing. It could be a cold laser, could be even a manual lymphatic drainage body work. You need to maintain that. So coming from you, I know that you also offer IV vitamins, which is amazing. So I want us to have a conversation around that.
Got you. So well said. Number one, weight loss is going to start with mindset. It always starts with mindset. I don't care who you go to see for what treatment you want. If the mindset is not focused on realistic goals, a realistic timeline to reach those goals, you won't be successful. So number one, yes, what got us in trouble, I'll say usually is overuse of calories or over intake of calories. And
Mhm.
so it's part of the American diet, is really just accessibility as well, but overtaking in calories is normal. Overtaking and over excess in calories. So here at Medically Fab, we offer semaglutide. So if you've heard of this, brand name might be Ozempic, for instance, or Wegovy. Um, this medication I'm really excited about. It was first used in patients who have diabetes, to treat blood sugar. However, we started noticing a weight loss side effect, that can be maintained, and also a healthy rate of weight loss. So semaglutide has been used for weight loss since 2021. So we started offering that here at Medically Fab. We have a cohort of young women right now, it's all women, who are using the medication and losing weight. Okay. The goal in any weight loss program or with any medication assisted weight loss is that you continue to exercise and to diet well. My goal is that you start to really just focus on realistic lifestyle changes that you can make, that you can sustain. So, for instance, I can't tell one of my clients who has multiple children at home to go to the gym. Like, you need a babysitter. You may not trust, whoever's at LA Fitness watching the kids today, to while you focus on working out. Like, it has to be realistic changes that you can make. So, for instance, like you said, it's getting warm outside, pack up the stroller, you push, and, let's go on a walk around the neighborhood, around the track, wherever your kids can be entertained and you can also, get these work off some calories. But it becomes a lifestyle change because now the kids expect to go with you, right? They're going to actually hold you accountable. I want to go outside today. And like, how can we kind of trick you into not even recognizing that you're spending time with your family, you're exercising, and you're feeling better about yourself? You might even be improving your mental health by getting outside,
Mhm.
you
For
know,
sure.
which was definitely my experience. I needed to get outside. I didn't realize how happy I could feel out in nature for an hour. Everything turned off and it became addictive once a day. And as a side effect, I lost weight.
Yay.
So, yes, but that's the key. Any weight loss program that you're on is going to have to include you exercising. And then, two, diet, diet, diet. It matters. You can never exercise away a bad diet. You can never take enough medication to get rid of a bad diet. Like, you have to kind of balance the two, and it's just something you're going to have to accept. When it comes to dieting, for me, the goal for weight loss is going to be a calorie deficit. If you only need, let's say you have a sedentary job, you're sitting down most of the day, you don't need more than 15 to 1800 calories in a day to be able to maintain all your body functions. You start eating 2000 calories a day, 2500 in a day, you're going to gain weight, right? Like, it's just natural. So a calorie deficit that you talk to your primary doc about, or you meet with me, we come up with a realistic calorie deficit that you can stick with, and we give you a cookbook. Let's work on maintaining this amount of calories in a day. Don't make it so, stringent that all of a sudden
Fantastic.
the weekends, yeah, it can't be stringent and drastic where you're getting lightheaded or you're, going not enjoying going out with your friends and things like that. I want you to make realistic changes while we're just amplifying with the semaglutide. I want you to still work on these lifestyle changes so that they stay and they're realistic for you. When we stop the medicine in 6 months to a year, you're still on your diet and exercise
Amazing.
regimen because it's just become a natural part of your lifestyle. Yeah.
So how many sessions do you normally start with? Sessions of injections.
Yeah. So the program is running 3 month intervals. All right.
Okay.
So for month, starting with, I'll say day 0 to your 3 month goal, I want you to lose 5% of your body weight. Most people can do that in less than 6 weeks with the semaglutide. Okay. Diet and exercise alone, you should be able to meet that 5% goal. So with the semaglutide, it's a must that you meet that 5% at 3 months. Okay. The injectable itself is once a week, and it's given sub Q right into the abdomen. All right. And you can do it usually from home. You come in, you meet with me first. We get your height, we get your weight, we go through your medical history to make sure you have no contraindications to semaglutide. Contraindications will include your personal history or family history of thyroid cancers, a very specific type of thyroid cancer. I want to hear as well that you've tried multiple ways of losing weight before you think medication is going to solve a problem.
Why is
What
that?
diet have you tried? Because medication alone is not going to change the mindset. That is the goal. If you cannot stick with a regimen at home, adding medication is not going to solve this problem long term. I'm not really interested in quick fad diets or using medication for a quick, I'm going to the beach in 3 weeks kind of goal. That's not my intention. So I need to make sure mindset is there. If you've tried a diet that is too strict for you, you were on the Atkins, but you want a piece of bread on a Saturday, that's, I get it. Like if you tried a diet that didn't work, I get it. So that's something that would make sense to me. I want to learn more about what have you tried? Why were you unsuccessful for your own goal? And what is your term of successful? What does that mean to you? What does unsuccessful mean to you? And why are you coming in?
Can I,
So yeah.
can I take advantage of this moment? Like I'm getting married in October, and I do exercise, and I have a pretty good diet, and I'm going through menopause, perimenopause. So I have gained not. I think my body just have expanded a little bit in my middle side,
Yeah.
right? So I'm working very hard to lose it, but it's stubborn. So how would you treat me knowing that there is this biological change, knowing that I'm pretty active? How would you approach someone like me?
100% still. We're going to go through a 24-hour recall. I know
Mm,
as far as diet goes, like I know that we are going to probably have to put you on a deficit to probably 1,500 calories, somewhere around there in a day. And that can be done in a way that you still have energy to work out, can be done in a way that you still like, you got to make the most out of what you're taking in. And somewhere we're probably sneaking in a little extra something somewhere that we might have to like start to limit a little bit more. I think you would be a prime candidate for some type of accelerator in the beginning, like semaglutide, for instance. Hormonal changes are one of those things we cannot fight when it comes to a cause of weight gain. It's like,
mm-hmm.
we can't get away from it. But definitely medication assisted weight loss when you're in the menopausal period can be very, very helpful at helping you to kind of get over a plateau. All right. As far as exercising, it's imperative that once you reach perimenopause and beyond and graduate into menopause, all right, that you still exercise and kind of maintain bone density. So some type of weights, when you exercise using some type of weight, okay, a little weight resistance is going to help you to maintain your bone density,
Mm-hmm.
okay. And add that to your exercise routine, a minimum of 5 days a week for 30 minutes. 5 days a week, 30 minutes, plus a calorie deficit of about 1,500 calories in a day is going to start to slowly lead to weight loss. And when I say slowly, it might just be a pound a month because you're literally
Mm-hmm.
plateauing and slowly
Mm-hmm.
losing. The semaglutide or any medication assistance, I prefer semaglutide because one, it's fewer side effects and it can be something you use for up to a year. Um,
Mm-hmm.
some people maintain it beyond that as long as you're closely monitored, it's fine. But
Mm-hmm.
adding that to kind of amplify and get you over the plateau, you'll start to see results. Definitely
Sign
before you,
me up, Doc. Sign
okay.
me up.
Definitely before your
I'll
wedding.
see you next week.
Hello.
So you walk me through it for let's say 3 months, right? So injections every week.
Every week. You see me every time we go up on dose. So day one, we start at a low dose of
Mm-hmm.
0.25. All right. So that's once we've gotten your history, we will get labs on you as well, and
Okay.
just kind of check your baseline functions and make sure you're not actually diabetic. At the
Mm-hmm.
We'll check your labs. All that comes back, we're good to go. You do in front of me. I watch you to make sure you can do this at home. But you come in.
Also, you give yourself the injections
No,
after.
I watch you give it to yourself. Yes, in front of me. When you it is the tiniest needle. It's the same as like basically a diabetic insulin needle, which
Mm,
people get from home all the time. The
okay.
thought of an injection, I think, is way worse than actually
Yeah.
doing. So come in, let me make sure you can do it from home. So we do the first one. I'll watch you do it, and we're here together. Make sure you don't have any side effects. You feel comfortable. Tell me, yes, I can do this from home. And if so, great. We graduate, you have all your supplies. I'll see you in a month. In 1 month, we'll go up on dose. Again, I'll watch you do it. 1 month later, we go up on dose. Watch you do it. And that's that. So we'll keep going up from 0.25 milligrams all the way up to 2.4 over a matter of 6 months is the goal. So at month 3, I need you to have what I'll say graduated from the lower
Mhm.
doses, showing me you have lost at least 5% of your body weight. You're tolerating it fine. You're still exercising. You are able to maintain a diet which is not restrictive. Like the term diet,
Mm.
I think people
I
think of it.
love that you're saying you make. I love the fact that you're highlighting that. That
It's
is not like you're not sacrificing your life, cutting off, food. It's
exactly.
doable. Yeah.
Thank you for saying yes, it is doable and it's realistic and it's healthy. It's healthy lifestyle. That's the goal. That's the goal. It's not a restrictive cut out this food group. I think that's unrealistic and is not going to last for most people. Yeah.
So in this kind of quest and losing weight, would you also suggest like IV vitamin drops and any enhancers into this program as well?
Well, I love a good enhancement.
Mhm.
We have IM, so intramuscular vitamins, which is a little different than IV. So yeah, it's a
Ah,
little different. Yeah.
okay.
So basically, IM injections are going to be just given right here into the muscle, the same as you might have received like your shots as a kid, same
Okay.
location. Okay.
Okay.
But again, what I like about it is that it kind of skips the digestive tract versus vitamins you might take over the counter, like by mouth. All
Mhm.
right. So more bang for your buck, I'll say. So B12, I like B12. B12 is important for red cell turnover. A lot of people report increased energy. And when you are on a regimen of exercise and diet, it's important that you kind of supplement with ways to help improve your energy levels. So
Yeah.
B12, I enjoy. There's a supplement called glutathione. Glutathione is not a vitamin, it's a supplement, but it is something that naturally occurs in our body. It's an antioxidant that also can help improve energy levels. So I love B12 and the glutathione together. Okay, and
So
those are
is your vitamins or enhancers, are they combined in one? Like like, do you create concoctions of them or they pre-packed?
I create concoctions.
Ah, nice.
I create concoctions based on what I
Love it.
think your concern is. We have vitamin C as well. So if you're, getting over, if you were feeling unwell recently and you just want like a boost of immune protection, like we have vitamin C would work well for you. If you're, low on energy, I think the vitamin C plus glutathione plus B12,
Mhm.
like you can kind of decide based on what your goal is. Yeah.
I've heard, or no, I didn't hear. I read that the B12 can cause acne. Is that true?
Oh, that's a good question. I've not heard that, but I would have to do more research on whether B12 can cause acne. I have not
It's
found that to be
it's
true.
related to the adrenal glands. It overreacts already. Maybe because if they already have active adrenal glands, it could cause. But I had clients that was taking biotin as a supplement, and a good a good 10 of them I said get off the biotin supplement, and then I did my research, and one of the ingredients is B12. So I was like, oh, maybe this is. So let's, stop. And it went away. So,
Really?
yep.
Yeah, I will definitely look
But
into
some people more prone, especially if they have, beyond cycle breakouts, they just
right.
struggle with acne. Um, but I just wonder if that is B12 or B6, because there's so many different Bs, B5 and all of those things. So
That is
yeah.
a good question. I will definitely look into that and let you know what I
Okay.
find.
So tell me, which products are you using right now? Of
Oh,
course,
my
you're using your products, but yeah. So
God.
tell us your secret.
Ooh,
Because you have a beautiful glowing, this is glowing skin through the video, glowing skin in person, on Instagram, everywhere. I
thank
love your
you.
skin, super healthy, beaming. So tell us your secret.
Thank you. My secret, my secret is Zeo Skin Health. I use the Zeo Skin Health products. It was formulated again by a physician, Dr. Zen Obaji, and I love the way the regimens are kind of laid out. And
Mhm,
basically, the treatment finders are going to be personalized. So I love Zeo Skin
mhm.
Health. Actually, here's some. I carry it. I want everybody to
Let me
see
see it.
it.
Yeah.
So
Tell us,
blue,
what is your favorite product?
easy.
Easy. Retinol.
Easy. Well, retinol is my favorite product. I'm going to get into that, but my
Uh-huh.
favorite from the line itself
Mm-hmm.
is definitely the exfoliating polish. The exfoliating polish. This will make your skin so glowy and soft immediately. I use it on my lips and everything. But it has magnesium in it, which is going to help to kind of pull away some of the toxins. And it's not too harsh. It's not too harsh. It also has tea tree oil in it.
Mm-hmm.
Wish you could smell it through the screen. It smells
Yes.
like vacation sea salt air. Like that's the
Uh-huh.
best way I can put
Uh-huh.
it.
Uh-huh.
Like I actually love it. This is like one of the products I cannot live without.
Mm-hmm.
Retin-A. Retin-A is the ingredient that is a must. I have been using Retin-A and I don't usually cycle, but I
Mm-hmm.
do use Retin-A
The prescription form or
prescription,
the skincare? Okay. Mm-hmm.
the prescription form. So I have been on Retin-A for my acne and it also helps prevent wrinkles. So for me, Retin-A, there's a product that I have quite a few of my clients on that they love, which is the retinol. So remember,
Mm-hmm.
retinol um, is going to be a form of the vitamin A that has to be activated in your body. So you don't need a prescription for it, but there's a higher concentration that comes from Zeo,
Mm-hmm.
1% retinol, which is pretty strong. You will still get the peel and high exfoliation rate, but the Radical
Mm-hmm.
Night Repair, 1% retinol, like people love this. My clients love it.
So how often would you recommend your patients to use the 1%?
Once a day in the evening. Once a day in
Okay.
the evening. That's it.
But then every night or every other?
So let's start with every other.
Mm-hmm.
Okay, see how your skin responds. You will start to kind of flake. You can start to feel a little irritated. This is not benign. Even though it's over the counter, retinols are strong and are not like
Yeah.
these easy benign things. Like it's a commitment, and especially 1% is going to be a commitment. So we'll step it up to nightly if your skin can tolerate.
Mm-hmm.
And that usually takes a matter of like 2 weeks to a month before we can actually get you to the point that you can start to accept retinol nightly. Um, Again, you'll need a sunscreen once you start a retin-A or retinol.
So so it's walk us through the process of your night regimen.
So first of all, get my diffuser going. But I start with the gentle skin cleanser. So a gentle pH balance cleanser, and I just kind of wash there. And I do use a cloth, but a gentle cloth
Mhm.
wash, and that's that. Then I exfoliate. So cleanse, then I exfoliate. I use the exfoliating polish that I just showed you. Gentle exfoliation. Your goal is not to like scrub off your skin here. It's a very gentle exfoliation. Then rinse that off. Then I tone, like a pH balanced toner, a little bit of witch hazel, very mild toner. So I prefer that. So cleanse, exfoliate, then I tone. And from there, I will put on, my next step is usually my vitamin C serum. I actually use vitamin C at night. I use it twice a
Nice.
day.
Mhm.
So vitamin C serum. Next, after that, I will use a ferulic acid serum, which
Mhm.
I love as well. Put that on top. From there, I will use my retin-A. So I have tretinoin, which is prescribed, like I stated, and I'll put that on. So if you see a dermatologist or another prescriber, a physician like myself, and it's deemed like we're actively treating like breakouts or something like that, and you're someone who would benefit from prescription strength, then we will do that. So then I put on my retin-A, and then after that, I put on my moisturizer, which I actually use Clinique's moisturizer. They're dramatically different. I've been using that since I was a teenager. It works for me, and it's soft and it's light. So I actually
Mhm.
use that moisturizer from there.
Mhm.
And that's it. So yeah, daytime is very similar. I still use my vitamin C serum during the day. I also use the, I go back and forth, but I will likely use my ferulic acid serum again during the day.
Mhm.
And I'll use a growth factor serum as well from
Mhm.
EO.
Do you when you decide to give yourself a chemical peel, so how soon do you stop using the retinol or tretinoin? Retinol.
Please, 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 please. At least 7 days. If I can get you 14 days, that is my goal.
Mm-hmm.
The worry that I have is that if you're already using an acid and then we put more on top, we're going to drive it too deep and then we run the risk of damage for the same reasons we already talked about. So minimum 7 days, 14 is cool.
Mm-hmm. I agree. And especially when you are performing a deeper peel. I perform more superficial peels. Even like my most aggressive, it's not closer to a medical grade peel, which is, mid and deeper. So I agree with you, especially with tretinoin, which is, the strongest form. So yeah, and working with a dermatologist before, I burned some skin because I forgot to ask at times, or they didn't tell me. It was my job to ask anyway. I could see the skin like doing a pure glycolic acid peel,
Huh? Super.
50%, okay? Pure. I've done glycolic peel, I've done salicylic, I've done retinol, like, packed peels. Like it sounds like a V peel without the kojic. Um, and it was like one or two patients that the skin frosted right away, and I was like, oh my God. But I was freaking out inside. So I just called, I worked with Dr. Taylor. So I said, Dr. Taylor, we have a situation. But then, you learn.
You do.
And so that's why I'm very comfortable in working in any skin, especially our skin, because it's more reactive. That's the difference, for sure. But chemical peels are amazing, well done. The technician has to know about, the skin, has to have an understanding of that client's journey as well. And also the product knowledge is very important too. Would you
Absolutely.
agree?
100%.
Mm-hmm.
Absolutely. Absolutely. Like why choose one peel versus the other? Like one that I really like for dark skin is the It's called Purify with Precision Plus. All right,
Mm.
from VIPO. And really the acids that you just mentioned are there. But it's great for darker skin, really, because it has retinoic acid in it. So again, if we have these acids in the pill, you really don't want somebody who's coming in already technically with that acid on their
Yeah.
skin, So it has the kojic in it to help kind of suppress the overactive melanin. It has TCA in lower amounts.
Dosage, yeah. And
Lower,
that's the trick.
that's the trick. That's the trick.
Because there are a whole bunch of TCAs out there. But at times some estheticians, they are not trained on skin of color, and they think that TCA is as good, and it's not good.
Burn.
And again, you have to count on what that particular client is using prior to. So yeah, and it comes down to knowledge and level of comfortability for them to address that skin, especially oil skin. And the most I can't say this, that none black non-black estheticians make these mistakes. That's not true. I've seen mistakes from both, from black estheticians and also Caucasians, because skin of color is not taught in school, and very, very, very minimum information. So you got to dedicate, as a professional, you have to look for continued education when it comes to treating skin of color. Big time.
Wow.
All right, my dear. So this was a fun conversation. We might need to bring you back in, because once my clients hear this beautiful episode, they're going to be like, oh my gosh, I have more questions. So, is there anything that you would like to add so you can feel this episode complete?
Just thank you for having me. Thank you so much for recognizing
Pleasure.
my goals, for being so kind and so open. Your advice, I so appreciate you. That's number one. Two, for anyone with questions, please reach out. We're on Instagram at medicallyfab_beauty. Feel free to DM us. Email us info@medicallyfab.com. I look forward to any questions. Let's take a journey together. Come support us. I can't wait to meet everybody.
Yeah. So all that information is going to be on the show notes, so they can find you easily, and that's pretty much it. So, Bonitas, I hope you enjoyed this episode. Please stay in touch with us. And once again, I hope you're having a great day, and I'll see you on the next episode. Have a great day. Ciao.